Hi, my name is Casey and I'm an occupational therapist student at Kaiser University. In today's video, I will be describing how to explain assessment components to an older patient who has just suffered a stroke. And I want to begin by saying that I always like keeping my instructions and explanations simple and short. I do not like creating confusion. And patients are there to recuperate and rehabilitate. They do not understand medical terminology, nor do they want to understand medical terminology due to the conditions they're in. So I always like to just create a warm environment and keep instructions and explanations simple and to the point, short. So the first one here is range of motion. The way I would explain range of motion is more of a visual explanation, or a visual explanation. So I would say, okay, I'm going to test your joint range of motion or your joint motions. Let's see how far you can move those joints, right? So that's how I would explain it. And then I would follow up by saying, can you do this motion for me? So I would show it, and then I would have the patient do the same motion so that I can measure that range of motion. So very short. Can I see that? How far those joints are moving? And then show them how to do it. And then we have the manual muscle testing. This one's even shorter. I'm going to test your strength, okay? I'm going to test your muscle strength. And then I would say, relax, lay back, and let me do the work. So then I would test or palpate the muscle and just keep it to myself. I'm not going to be like, let me palpate your biceps, let me palpate this muscle. Like, they don't know what's going on. So just keep it short and simple. We're going to test your strength, okay? Lay back and relax and let me do the work for you, okay? And then we have the sensation testing. For the sensation testing, we explain, I'm going to be testing your sensations on different areas of your body. And so then I would go right ahead and test one area where they do feel sensation, and then test it on that exact area, but on the opposite side. So can you feel this? Yes. Can you feel this? Yes or no? Okay, can you feel this? So it's very simple. I'm going to be testing your sensation. Can you feel this? Yes or no? Can you feel this? Yes or no? So it's very simple. You want to keep it as simple as possible so that they don't get confused. They don't start, getting agitated maybe. I know that when I've been in situations that I don't understand something, I become a little anxious, and that's definitely not my goal with patients, especially older patients. And then when testing orientation, I would say, okay, now we're going to test a different area. I'm going to be asking 3 different questions, or however many different questions you're going to be questioning them, and say, okay, do you know what time it is? Or do you know what day it is? Okay. What hospital are we in? And sometimes what I like to do is kind of, when I'm introducing myself, I'll ask different questions without really going to be specific, or like now that I'm saying it's gonna be a different assessment. I don't like maybe making them think like they don't know what, childish, or that they don't know what they're doing or where they are. Sometimes I like to include this part of the assessment in the introduction. So I ask casual questions without them knowing that I'm assessing them. And so, this is another assessment that I do while I'm doing every other assessment. So I'll include little questions here and there, and that will give me if the information on whether they're oriented or not. And so these are the 4 areas that I would explain to the patient, and how I would explain it to them. And like I said previously, I like to keep it short and simple. So these are the 4 areas. Keeping it short and simple is the best way to go, especially in older patients. So thank you for watching my video today. Have a good night.